Ziva Fertility Centers is running free fertility camps at all our centers in Banjara Hills, Sanat Nagar, Kompally and Manikonda on all Saturdays this coming month of July. Please come down, evaluate yourself, understand your infertility and your chances of fertility with the treatment options available. There are heavy discounts given on IVF procedures. Thank you. Hi, I am Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Today's topic is how to improve your IUI success rate. Well, there are three important factors that are playing into account when we're talking about the success of an IUI. IUI is intrauterine insemination, where the sperms are put into the uterus. Now, the first important factor is whether the sperms are good or not. And to analyze this, semen analysis is done. Anything above 15 million per ml and a good motility of 40% with progressive and non-progressive sperms means that your success rate could be high. The next factor is whether your partner is ovulating or not. If it is with or without medications. If it is a regular cycle where ovulation is happening on its own naturally, or it requires medications in conditions such as PCOD or irregular cycles. Now, ovulation is a very important factor. If the egg is not ovulating, then the success of IUI also comes down. The third factor is whether the fallopian tubes are open or not. So, these are the three most important things that contribute to the success of an IUI. Now, what is the procedure? Well, IUI is a very simple procedure. So, the semen sample is taken and processed. Now, what is this process and why do we need to process it? Well, understand that sperms come with seminal fluid. Inside the seminal fluid are chemicals called as prostaglandins. These are hormones and chemicals which are very harmful to the uterus. It is devised in such a way that all the seminal plasma is left behind in the cervix and only the sperm swim up. But if we were to put this seminal plasma inside the uterus, then the side effects could be very severe. There could be cramping, there could be nausea, there could be diarrhea, there could be high temperature. Prostaglandins present in the seminal plasma could cause all these symptoms. Therefore, it is very important to process the seminal fluid. What we do in the laboratory is separate the seminal plasma from the sperms. Just the sperms, highly motile, vital, alive sperms are taken in a very thin catheter and put inside the uterus. It's a very simple procedure. It's done in the clinic itself, not in the operation theatre. Very simple in a 5-10 minutes procedure. Now, when this is done, the sperms are pure. They do not have dead, immotile, debris not present. All these sperms are good. Therefore, when it is put inside the uterus, the time to reach the egg is also shorter. Therefore, pregnancy chances are higher. Now, there are a few questions that patients ask us. Whether two IUIs back to back are more beneficial before ovulation and at the time of ovulation. Well, to understand this, we need to understand what studies say. Studies have been done to show the difference between two IUIs, that is before ovulation and at the time of ovulation, and only one IUI, that is after the ovulation has been done or just before the ovulation. It has been proved that there is no significant difference between both the procedures. Whether you do two IUIs or a single IUI, your success rate remains the same. The second question patients ask us, because there is a lot of hearsay that taking rest will help them get pregnant. Again, if you look at the studies, it has been proven that patients, when they take rest for about 15 to 20 minutes after IUI, their chance of success is a little higher than patients that do not take rest after IUI. So, it is just for 15-20 minutes that the patient is advised to lie down and then they can be up and about. So, yes, studies are what are important to see whether any particular method makes a difference or not. Now, coming back to the process of purifying the sperms, there are multiple processes. There is a double density gradient, there is a swim up, swim down. All these processes do not matter as long as the concentration of good quality sperms are collected at the end of it, which are transferred into the uterus. So, this is a very simple procedure. The fear of IUI is just that medications are being given and maybe there is some instrumentation. Please do not worry. It's a very simple procedure to get done. If you wish to get an IUI done and you are getting worried, you need more information, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.